ngegunya engilinikiwe njengomphathiswa wale nyuvesi yaseThekwini yezobuchwepheshe nami ngimelele esithi phecelezi uchancellor wethu umama uNonkululeko Nyembezi. Ngiyawubumba ke lo mbuthano wale nyuvesi onhloso yawo ukwethweswa kweziqu ezimazingazinga. By virtue of the authority vested in me as Vice-Chancellor and on behalf of our Chancellor, Madame Nonkululeko Nyembezi, I now constitute this congregation of the Durban University of Technology for the purpose of conferring degrees and awarding diplomas and certificates. Ngicela ke nithi kozololo. Will you please take your seats?
Sanibonani, Molweni, Dumelang, good morning. Welcome to the 2023 Autumn Graduation Ceremony. My name is Alan Khan. I'm the Senior Director of Corporate Affairs at DUT, and it's my privilege, my pleasure, and my honor to act as your Program Director at this morning's graduation ceremony. I would like to acknowledge in absentia our esteemed Chancellor, Madam Nonkululeko Nyembezi. Welcome our Vice Chancellor and Principal, Professor Thandwa Mthembu, the Chairperson of DUT Council, and members of Council, to our guest of honor and our honorary doctorate degree recipient this morning, Professor Salim Abdul Karim, together with his family and friends who are present, the President of Convocation, members of Convex and the broader university alumni, members of the executive and senior management teams present, members from the Faculty of Health Sciences, and my colleagues from the administration and support services units at DUT. Internal stakeholder leaders from the Institutional Forum, the Gender Forum, and from our unions, the President of the Student Representative Council, members of the SRC, and members from the Student Parliament. All protocol observed, and a very special welcome to all of our graduands, their family and friends, parents and guardians, funders and supporters, to everyone assembled in the hall this morning, and for those who are currently watching the online stream on the DUT YouTube channel, thank you for making the time to be with us to celebrate this remarkable milestone in the lives of our graduates. Today we celebrate excellence. Today we celebrate our adaptive graduates at DUT. The DUT Envision 2030 strategy, which was launched just over 3 years ago, continues to make a meaningful impact at our university. Based on our plans, our university is focused on doing things right. As our Vice Chancellor and Principal, Professor Mthembu, highlighted during the recent State of the University Address, for the second year in a row, Durban University of Technology was ranked in the top 5 of all South African universities in the Times Higher Education World University Rankings that were announced in London. DUT was also ranked as the #1 University of Technology in South Africa. And for that, I think all students, all staff, everyone associated with the university deserves a round of applause for DUT and the flag flying so high around the country and around the continent. Late last year, PMR Africa, which stands for Professional Market Research Africa, named Durban University of Technology as the #1 higher education institution in KwaZulu-Natal and presented DUT with the 2022 Leaders and Achievers Award. Honored guests, we are extremely proud of every single one of our students and staff who continue to live the values and principles as enshrined in our Envision 2030 strategy. You may have noticed on stage with me this morning, to my right, on your left, we have a sign language practitioner. She is a member of a team of sign language practitioners providing sign language services to our graduands and guests who may have hearing impediments. Also, to those guests who have borrowed our headphones, these headsets, sadly for you, do not pick up your favorite radio station, so no Gagazi, East Coast, or Ukozi FM. These headsets are purely designed so you can pick up our free interpretation services. We have our language interpreters in the sound booth at the back of the auditorium, and they're providing interpretation from English to isiZulu. It's customary at all DUT graduation ceremonies. But please could I humbly request that you return these headsets to us after the ceremony so we could use them at future events. We also have paramedics with an ambulance on standby. Let's hope we don't need it. This is our 33rd graduation session for the autumn graduation season, and we haven't had any medical emergencies. I know this is the Faculty of Health Sciences, so please don't test us today. In the event of anyone, our graduates or one of our guests feeling unwell at any stage during the ceremony, please notify one of our ushers or a member of our security team, and we'll get you the emergency medical attention you deserve. In fact, we have more than just 2 medics today. We have a whole field of health experts in the auditorium, so you will certainly get the assistance. Vice-Chancellor, ladies and gentlemen, as I mentioned, 33 sessions over 12 days in 2 cities, 8,122 graduates would have graduated this autumn. A record-breaking 61% of the 8,122 graduates at DUT this autumn season are women, which means at DUT, girl power is alive and well. Congratulations, ladies. Keep rising. For those who will graduate today, you will now become members of the DUT alumni. I really hope that you will be active members of our convocation and that you will engage with our hardworking team from the Advancement and Alumni Relations Office. Vice-Chancellor, ladies and gentlemen, I did mention the introduction that we are very honored today to have as our chief guest and someone who has accepted our invitation to receive an honorary doctorate degree. He's with us this morning and he's on stage, Professor Salim Abdul Karim, the famous South African clinical infectious disease epidemiologist. He became a household name. I think even before COVID-19, he was really famous and on the map for the work that he did in the prevention and treatment of HIV. We will go through his citation, we will present him to the congregation, and we will start this morning's graduation ceremony with the conferment of the honorary degree on Professor Salim Abdul Karim. To get us underway, I'd like to invite the Executive Dean from the Faculty of Health Sciences to commence with the conferment process. Please welcome Professor Mkunu.
Vice-Chancellor, I have the honor to request you to confer the degree of Doctor of Philosophy in Health Sciences, honoris causa, to Professor Salim Abdul Karim.
I confer the degree of Doctor of Philosophy in Health Sciences on Salim Abdul Karim.
I would like to invite our recipient, Professor Salim Abdul Karim, to join me at the podium as we present and read his citation. Salim Abdul Karim was born in 1960, right here in Durban in KwaZulu-Natal. He matriculated from Gandhi Desa High School in Durban in 1977 and attended the University of Natal's medical school in the late 70s. He conducted and published his first research project in the International Journal of Health Services under the mentorship of Professor Jerry Kuvadia. He was a third-year medical student at the time. While completing his medical degree at the University of Natal, he simultaneously studied computer science and statistics at the University of South Africa. After completing his medical degree in 1983, he was awarded the master's degree focusing on epidemiology at Columbia University in New York. He returned to the University of Natal to complete another master's degree in public health and then also a PhD. Professor Abdul Karim has played a leading role in the HIV, AIDS, and COVID-19 pandemics. His scientific contributions have impacted the landscape in HIV, AIDS prevention and treatment and COVID-19 response, in the process, saving countless lives. He co-led the research that provided the first evidence for antiretroviral pre-exposure prophylaxis, and that was against HIV infection, a finding that was heralded by UNAIDS and the World Health Organization as one of the most significant scientific breakthroughs in the fight against HIV/AIDS, and it has been ranked amongst the top 10 scientific breakthroughs of 2010 by the journal Science. His clinical research on TB/HIV treatment has shaped international guidelines on the clinical management of co-infected patients. He is co-inventor on patents which have been used in several HIV vaccine candidates. During the COVID-19 pandemic, Professor Abdul Karim was selected to lead the 41-member Ministerial Advisory Committee on COVID-19. This committee provided guidance for the South African government's response to the COVID-19 pandemic. During this crucial time of the COVID-19 pandemic, Professor Abdul Karim led the South African response to COVID-19, providing the public and the government with scientific advice on the coronavirus, how it causes COVID-19, and importantly, the measures of preventing further infection. Terms such as flattening the curve have been explained clearly to the South African public by Professor Abdul Karim. He could easily explain complex science terminology to members of the general public in such a way that they were able to understand their involvement in containing or spreading the epidemic. For this critically important role in the COVID-19 pandemic, he received jointly with Dr. Anthony Fauci the 2020 John Maddox Prize for Standing Up for Science. Professor Abdul Karim's primary academic appointments are the Director of the Center for AIDS Program of Research in South Africa and the Caprisa Professor for Global Health in the Department of Epidemiology at the Mailman School of Public Health at Columbia University. His additional academic appointments are Adjunct Professor of Immunology and Infectious Diseases at Harvard University in Boston, Adjunct Professor of Medicine at Cornell University in New York, and Pro-Vice Chancellor Research at the University of KwaZulu-Natal in Durban. He previously served as President of the South African Medical Research Council. He currently directs 4 research centers, some of which are embedded within Caprisa. He is the Director of the UNAIDS Collaborating Center for HIV Research and Policy and the Global Virus Network Center of Excellence, the MRC Extramural Unit for HIV/TB Pathogenesis and Treatment, and the DSI NRF Center of Excellence in HIV Prevention. Professor Abdul Karim was appointed in 2022 as a special advisor on pandemics to the Director General of the World Health Organization. He is a member of the Science Council and the World Health Organization TB/HIV Task Force. He is a member of the African Union Commission on COVID-19. He is a member of the American Association of Physicians and serves as Vice President of the International Science Council. Professor Abdul Karim has published about 500 journal articles, 12 book chapters, co-edited 3 books, and holds 6 patents. Professor Abdul Karim has been ranked among the world's most highly cited scientists by Web of Science. He serves on the boards of several prestigious journals, including the New England Journal of Medicine, Lancet Global Health, and Lancet HIV. He is an elected fellow of the World Academy of Sciences, the African Academy of Sciences, the Academy of Science in South Africa, the Royal Society of South Africa, and the American Academy of Microbiology. He is a member of the US National Academy of Medicine, and he is a fellow of the Royal Society. His many awards include the African Union's Kwame Nkrumah Award, Africa's most prestigious scientific award. He's ranked as one of 50 all-time legends of South African science by the Academy of Science in South Africa. Some of his awards are the Drug Information Association's President's Award for Outstanding Achievement in World Health, the African Academy of Sciences Olusegun Obasanjo Prize, the Gold Medal Award from the South African Medical Association, Kuwait's Al Sumait Prize, and the TWAS Prize from the World Academy of Sciences. He has received the John W.F. Herschel Medal, the highest award of the Royal Society of South Africa, the Science for Society Gold Medal Award of the Academy of Science in South Africa, and the SAMRC's Platinum Medal Lifetime Achievement Award. In 2021, the African Union and the African CDC awarded Professor Abdul Karim with the Lifetime Achievement in Public Health Award. Both Professor Karim and his wife, Dr. Qureisha Abdul Karim, jointly received the Institute for Human Virology Lifetime Achievement Award, the John Dirks Canada Gardner Global Health Award, the inaugural Vietnam VinFuture Special Prize, and most recently, literally a few weeks ago, they were in Japan to receive the prestigious Hideo Noguchi Prize from His Excellency, the Prime Minister of Japan. I now ask the Executive Dean to return to the podium to commence with the conferment of the degree.
Vice-Chancellor, for the degree of Doctor of Philosophy in Health Sciences, honoris causa, I present Professor Salim Abdul Karim.
Receiving his honorary degree from the registrar, Professor Karim, before you leave, that's the important piece of paper that will be framed. And we'd like to formally, and please could the congregation join me in congratulating and welcoming Professor Salim Abdul Karim into the DUT family. One of the most distinguished South Africans you'll ever meet, down to earth, humble, and a man with his heart in the right place. To deliver his conferment address at this morning's graduation ceremony, Vice-Chancellor, ladies and gentlemen, he told me, Alan, I have no speech prepared, it all comes from here. And I said, well, we are ready and waiting. Please put your hands together once again for Professor Salim Abdul Karim.
Vice-Chancellor, members of the University Executive, colleagues and academic staff of the Durban University of Technology, parents and students, ladies and gentlemen, it is indeed a humbling honor for me to be here in this august occasion. I have to say that I had a few shivers run down my spine as I listened to Alan describe the accomplishments of DUT. Not just the large number of graduates, but also the proportion that are women. And indeed, my eyes, as I walked in, looking at the sea of red in the front row, speaks volumes. It is a special occasion, the day that you get to wear the red robe, the day that you can call yourself an academic, a day on which your life will change forever because everybody will call you doctor. That's the day for each one of you. I'm honored to share this day with you. I asked Alan Khan, what should I speak on? Would people be interested in HIV? Would they be interested in cholera? Or would they be interested in COVID-19? And he said, do whatever you feel would work. So, I am going to tell you a short tale about COVID-19. It's a Monday, 30th of December 2019. I and my family are hiking on the foothills of the Drakensberg mountain. It's a bit of an uphill climb, and you know, I put on a few pounds, so it gets a bit more difficult for me when it comes to the uphills. And as I'm trudging along at the rear end of this family chain, my watch beeps. I have an Apple iWatch. In it, it says, alert, ProMed alert, undiagnosed pneumonia in Wuhan, China. I stopped dead in my tracks. I look at my watch and I said, why are we being alerted about undiagnosed pneumonia in China? It must be SARS. What else can it be? And I promptly ignored it, thinking that this can't be anything important. I couldn't be more wrong. So I come back to work, and it's the 11th of January, 2020. My colleague, Professor Tullio de Oliveira, whose laboratory and office is one floor below mine at the medical school in Imbali Road, he comes up rushing to my office. Have you seen Twitter? I said, what on earth is this Twitter? And he shows me, he says, look at this. This pneumonia is being caused by a coronavirus. I said, what? A coronavirus? He says, yes, it's on Twitter. I said, you can't be serious. Science is in big medical journals, not on Twitter. Well, for me, it was the start of how science was changing and how social media became the mechanism by which we were learning about new things in science. And indeed, COVID-19, as the disease was later known, changed the world of science. I get an email on a Sunday morning, early in March, and it's from the special advisor to the state president of South Africa. The message says, we are preparing for the pandemic. Can you give us some assistance? And I said, I wrote back, it's a Sunday morning, that sure, not a problem. Well, I didn't realize that that actually meant I had to do some work straight away. And so Professor Shisana, who sent me the email, sends me a document and she says, can you look at this and advise us what of this is relevant for South Africa? The document was the plan that was developed by the Wuhan hospital to deal with COVID-19. I have to say, I was amazed when I read this document. It's available on the web. It described in great detail how they were going to implement the lockdown, exactly how anybody who got sick would put a red flag outside their building along the street, how teams would be going around looking for red flags to come and assist people who were ill or who were in distress, had no food or had some kind of problem. When I read this, I said, my goodness, can we do anything like this? And I then jotted down some key elements of what we needed to do. A few days later, the WHO released a report about the effectiveness of the Wuhan interventions, showing the way in which lockdowns can reduce the spread of the virus. It became obvious as country after country went into lockdown. It was now the 7th of March, 2 days after the first patient with COVID-19 was announced, that it became clear that we were going to see a massive epidemic of COVID-19 in South Africa. There was no getting away from it. We had to be ready. And so a call comes to my office from the Office of the Minister of Health. Can you join a meeting to discuss this new pandemic? And so I do. At that meeting, which takes place on the 23rd of March, I'm joining by Zoom from my office. The minister outlines what is the current evidence of COVID-19, how it is causing mayhem in Italy. It is causing mayhem in New York City. We were already on our television screens seeing Central Park in New York converted into a sea of tents, converted into field hospitals. Hospitals were being overwhelmed. And they were being overwhelmed for one very simple reason, that COVID-19 caused a pneumonia that led to an inability to exchange oxygen. Literally, people were drowning in the liquids and the pus that was collecting in their lungs and couldn't get oxygen. They needed oxygen, and they needed to go onto ventilators to get enough oxygen. As we watched this, we had to know how many ventilators do we have in South Africa? Well, that's not an easy question to answer. Looking at KwaZulu-Natal, we did a quick survey to get that information. Would you believe it? KwaZulu-Natal had just under 130 ventilators in total, half of which was in one hospital, St. Augustine's. Now, if we only have 130 ventilators, and we are going to see a few thousand patients needing ventilators, we were in trouble. We had to develop alternate plans. Just at about that time, it's a Friday night, I get a call from the Director General. There's a crisis at St. Augustine's Hospital. There's an outbreak of COVID-19. Can you please go and investigate? So Saturday morning early, I head out to the hospital. It is now like Fort Knox. Nobody can get in, nobody can get out. So I get to the guard at the front gate and I say, I'm here to investigate the outbreak of COVID-19. And he says, sorry, sir, not possible. You cannot go into this hospital. It is quarantined. And I said, yes, I know that, but I need to go in. So here was a situation where we had in this hospital COVID-19 spreading like wildfire. Everybody was scared to go in. And I'm the only crazy person trying to go in. As I entered, when the superintendent of the hospital opened the gate for me, and I sat down with the team, the infection control team, I was able to actually trace how the virus entered the hospital. It was a patient who'd just come back from London. He was feeling ill. He thought he might have COVID. He came in for a test. They brought him through a side entrance, but they took him into one section of the emergency room separate from everyone else. How could he have spread it to everyone else? Well, it turned out that the doctor and nurse that attended to him then attended to an elderly woman, and that's how it spread. She went into the cardiac ICU, spread it to 4 others. When she got to the ward, she spread it to 8 others. 4 of those people were spreading it to other people. By the time she went back to the Bill Buchanan Home for the Aged, she infected 6 others. I was beginning to understand SARS-CoV-2. I was beginning to understand it firsthand. That was the challenge that we faced. We had to deal with this pandemic. We had to understand it. We needed the evidence, and we needed to provide that scientific evidence to our policymakers so that they can make the right decisions. But you know, politicians don't always make the right decisions. And politicians don't always ask for advice. And so we had this ridiculous situation where policies and some policies were being made that made no sense. For example, that you can't wear open-toed shoes, but you can wear closed-toed shoes. I'm not sure who in the government made such a stupid rule, but it was very obvious to anybody. You didn't need to have a PhD in medicine to know that that's not based on any evidence. But for the most part, our government did the right thing. Decision after decision was based on the advice that we provided. In the first year of the MAC on COVID-19, the Ministerial Advisory Committee on COVID-19, we provided the Minister of Health with 119 advisories. Of those advisories, only 4 were not implemented. Every one of the others was implemented. 81% of them were fully implemented. So that tells you that when you look at South Africa's response to COVID-19, as was done recently in the Lancet Commission on COVID-19, and as you compare to other responses around the world, South Africa was indeed quite fortunate in that our response was quite a reasonable one. It was not the best response, it was not the worst response, but it contained many elements of the way in which we should deal with COVID-19. As we think today about COVID-19, we have to banish the idea that this is now a respiratory-only illness. We thought in 2020 that COVID-19 was an acute respiratory infection. In other words, it's an acute onset infection in the lungs. Today, we know that that is a short-sighted and inaccurate view of COVID-19. COVID-19, SARS-CoV-2, the virus, literally infects the entire body from head to toe. In the head, it can cause strokes. It can cause meningitis. In the toe, it even causes something called COVID toes, a little purplish blemish that you get in the vessels, the small vessels of the toe. Literally, it infects every part of your body. We are now seeing 1 year, 2 years after people were infected, we are seeing the effects of long COVID. Long COVID occurs in about 10 to 20% of people who developed acute COVID-19. And long COVID brings with it what is referred to as this malaise. They refer to this fog. They can't concentrate, they can't work. In the UK, over 500,000 people have chosen to leave their jobs because of long COVID. We are now dealing with a different enemy. We are now dealing with an enemy that is not presenting as it did in 2020. So hospitals are no longer filled up with patients looking for ventilators. Today, our patients with COVID-19 are illustrating the long-term effects. What are those effects? They affect the heart. They increase myocarditis. They increase strokes. They increase heart attacks. And we have to, when we see a patient today with those illnesses, we have to think back to their COVID-19. So to all of the students, I want you to remember that you are the privileged in our society, that many, many people have toiled long and hard to work and pay their taxes so that you can get an education. You are now the future of our society. We will depend on you. I want to leave you with 3 key concepts that come from my work on COVID-19 that taught to me what is needed to succeed in the world as an academic, as a professional, as somebody who is now going to lead and be part of the leadership of our country. The first is find your passion. Find the thing that makes you wake up in the morning. Find the thing that lights the fire in you. It will find you. Don't despair if you haven't found it already. But find it you must. It is going to be the basis on which you will find your calling in life. You will find what excites you. You will find what makes a difference to each day in your life. The second I want to tell you, after finding your passion, is to persevere. Nothing comes to those who don't have the patience, who don't have the perseverance. If something comes very easily, it means that many other people also have it. You have to take on the difficult challenges in life. And that means that you must never give up as obstacles are put in your way. You have been given an education to overcome those obstacles. You must learn to persevere despite every obstacle that's being put in your place. And finally, as you think about your passion, as you think about perseverance, just remember that in this world, we all search for excellence. Be the best that you can be. Never settle for second best. You have reached a privileged position in our society. You have been given an opportunity. It is up to you to raise our country, to raise yourself, and to raise your family. And with that, you will find that you are making a contribution to the world. And that's what each of you is destined to do, to make a difference in the world. Thank you.
Vice-Chancellor, ladies and gentlemen, Professor Salim Abdul Karim. I did notice Professor Abdul Karim mentioned passion and your purpose and excellence. You notice that was PPE, personal protective equipment as well. So you can see there's a link in everything that he does. Inspiring, insightful, and entertaining. 3 things stand out for me in summary. Firstly, he received data coverage in the Berg. I mean, isn't that a miracle? On his Apple Watch. That's the first thing. The second, he gets an SMS from ProMed or a message on his device. My message on my device, if I'm out hiking, heaven forbid, is make sure you bring bread and milk home this afternoon. So clearly my sources and Professor Abdul Karim's sources are poles apart. And the third, on a more serious note, is that Professor Salim Abdul Karim is without doubt a national treasure and an international gem. Once again, Vice-Chancellor, ladies and gentlemen, Professor Salim Abdul Karim. So graduates, or graduands, it's about time to get you on stage, and we're going to take you through the process. Some of you, especially those in our red robes and those who've been here before, know the process. Others are experiencing it for the first time, and also for our guests. So I'm going to take you through, not just verbally, but we're going to explain and demonstrate the very simple process that some may just forget. Or last week on Saturday, one of our graduates just walked up on stage and walked straight off stage. He didn't want to have anything else to do. We had to bring him back on, and he was a bit nervous. So I'm going to just quickly take you through that. But an important announcement. I mean, you know the saying, graduates, what happens in Vegas? Not anymore, right? What happens in Vegas stays on Facebook, TikTok, Instagram. And I know, like Professor Abdul Karim, you've got your mobile device with you. I've seen some photographs and selfies and pouting your lips and flicking your hair. So please hashtag us on those photographs. I mean, we've seen some amazing pics over the last 2.5 weeks from your fellow graduates. One thing I do know is that DUT graduates don't just work hard, but they play hard and party hard too. So hashtag DUTgrad23. And just remember, we've given a very polite, friendly word of warning to our graduates when you're partying and posting pics. At some point, a potential employer would look at those photographs in the months or years ahead. So just think about the future in mind before you post things. I'm going to ask one of my colleagues, Mr. Nkululeko Mbata, who is a former Mr. DUT and a reigning Mr. Supranational South Africa runner-up, to join me on stage. As a member of our communications team. And we're going to explain, for the benefit of our graduates and our guests, what will happen. In a minute or two, we'll invite our graduates to line up on your left-hand side. Only stand up when you're invited, and you'll make your way to the stage. Please make sure you bring your name card with you and your hood, the sash. Leave your mortarboards on the chair. When you arrive at the podium, you will hand your name card to the executive dean or to the head of department, and the qualification and your name will be read. And in this case, Mr. Nkululeko Mbata. Now, from where I'm standing, and I'm sure Nkululeko will agree with me, you are all looking fabulous. The hair tops, the shoes outstanding. I mean, the makeup, the extensions, everything is really, I mean, it's on par today, right? So present yourself to the congregation. Look good. Also, we have a photographer right in front, graduates. You want these photographs to last a lifetime. So look at the camera, smile. We have a set of footprints on the floor, and it'll help you with your positioning. Once your name is read and your photograph's taken, you then take your name card back from the podium, because you're going to need the name to be verified at the back of the hall, because you're receiving your qualification in a white envelope today. So we need to make sure that the faculty office team hand over the qualification to the right person, and your name card is the proof. You will then walk down the red carpet, bearing in mind it's a graduation ceremony, so there's a bit of dignity and respect. You can see Nkululeko is not dancing, screaming, shouting, trying to incite a party atmosphere. He's then going to kneel in front of the Vice-Chancellor. That device is called a kneeler. It's not a stool, it's not a chair. Please don't sit on it. Have a chat to the Vice-Chancellor. Don't ask him, Prof, how's the weather? Or how's the traffic this morning? Do you prefer Chiefs, Pirates, or Sundowns? The Vice-Chancellor has a purpose because he's going to be capping you. It's an important part of the graduation ceremony. He will confer the degree. You look at the Vice-Chancellor and look lovingly at the VC as well. I mean, he sees a lot of people over 33 sessions. So look at the Vice-Chancellor, don't look at the floor, and I'll tell you why. There's another photograph to be taken. So you don't want to be gazing onto the ground. Look at the Vice-Chancellor, smile. The camera is behind me, and it will capture the moment that you're being conferred, okay? You will then rise, and you will walk down to the registrar, Dr. Nkonowane. You will hand over your hood. If you're tall like Nkululeko, be considerate, just bend down slightly. Let Dr. Nkonowane hood you. You then smile, because there's a third photograph going to be taken. So here's my advice. Make sure, one, if you're going to be emotional and cry, do so in your chair, wipe up, don't do it here. Especially if you're wearing mascara, because you're going to ruin your photographs. That's one. Two, if you're chewing gum, make sure nothing is stuck between your teeth, because you don't want to be ruining your pics. And 3, keep your eyes open, because trust me, these photographs, you're going to proudly display them on a cabinet, on a table, on a wall, your parents, your grandparents, your kids and grandkids. So you don't want to ruin it for future generations. So there's a lot of pressure on you. You now know what needs to happen. I don't think there are any diplomas that are going to be handed out at the ceremony, but the only difference generally when there are diplomas is that there's no kneeling because there's no capping. It's not a degree. A deputy vice chancellor will stand up and congratulate you, and then you move to the registrar. That's the only difference. My thanks to Mr. DUT and Mr. Supranational first runner-up, Mr. Nkululeko Mbata. Graduates, you now know what to do. You've got the advice. Enjoy the ceremony. Please, I ask once again if you can humbly respect all of our graduands. Every single person who's here deserves to have their name read. Every loved one, family member, friend, supporter, guardian who's in attendance today also wants to hear the name of their loved one being heard throughout the auditorium. So please be considerate and respectful of the ceremony and of your fellow graduates today. Kindly stay with us for the whole duration of the ceremony. I see we have a number of red robes, so doctorates and citations will be read. We've been averaging around 90 minutes for the ceremony. If all goes according to plan, maybe around 11 or just after 11:15, we should have you celebrating for the rest of the day. Without much further ado, Vice Chancellor, ladies and gentlemen, to commence with the second part of this morning's graduation ceremony, I once again invite to the podium the Executive Dean for the Faculty of Health Sciences, Professor Mkunu.
Vice Chancellor, I have the honor to request you to confer the degrees on the graduates from the Faculty of Health Sciences who will be presented to you and in absentia to those whose names appear on the program.
By virtue of the authority vested in me, I confer the degrees as in the program.
Vice Chancellor, for the degree of Doctor of Philosophy in the Faculty of Health Sciences, the degree of Nursing, I present Phuvanasri Padayachi. The title of the thesis, Guidelines for Pedagogical Practices to Ensure Research Preparedness of Undergraduate Nursing Students, a case study of institutional perspectives and practices, supervised by Dr. V. Naidu and co-supervised by Professor M.N. Sibia. I will now call upon the supervisor to read the summary.
The summary. The dynamic field of research is considered a diligent and systematic inquiry into the nature and society, and both exist to validate and refine the existing body of knowledge. Reputations for pedagogies and research are being interwoven globally, and universities have positioned themselves competitively to define their particular and distinctive approaches to knowledge transfer and knowledge acquisition. Whilst the aim of the study set out to explore perspectives, practices, and experiences of lecturers in the undergraduate nursing research pedagogical sphere, locally, nationally, and internationally, the ultimate aim was to develop a set of guidelines that would assist in informing and advising all stakeholders in research pedagogy of the multiple dimensions and constraints of pedagogical circumstances in undergraduate nursing education, and in particular, nursing research. The study adopted a qualitative exploratory descriptive design in its methodology and explored current local, national, and international pedagogical practices and institutional perspectives and practices in the teaching and supervising of the research module. Findings noted that while there has been a shift towards a research and inquiry-based learning environment across the global higher education sector, international and local institutions are trying very hard to increase undergraduate students' exposure to research and inquiry, both inside and outside of the classroom. The success of this is still highly dependent upon individual academics' perceptions of teaching research and the development of their own academic identity. There appeared to be a lack of structured guidelines to inform the relevant stakeholders on the delivery of the research module, together with insufficient timeframes for teaching and facilitation thereof. These findings aided in the development of guidelines for pedagogical practices that would serve to ensure research preparedness of undergraduate nursing students that would benefit them as they transition to postgraduate nursing research. Thank you.
For the degree of Doctor of Nursing, I present Puvanestri Padayachi. The title of the thesis is Health-Seeking Behavior Among Women in Northern Nigeria, a framework to promote autonomy, supervised by Professor T.S.P. Ngongo and co-supervised by Dr. V. Naidu. I will now call upon the supervisor to read the summary.
Thank you. The summary: morbidity and mortality rates continue to be a major healthcare problem in developing countries, and the majority of deaths are often as a result of disparities that prevail in healthcare delivery, such as inaccessibility and difficulty in accessing healthcare providers by pregnant women. The cultural and social beliefs of the community cannot be overlooked due to their influence on the decision to utilize healthcare services. Autonomy to seek healthcare amongst married women is a major challenge in most developing countries, including Nigeria. Cultural and religious beliefs affect the married women from Nigeria, many of whom face the possibility of dying due to the lack of autonomy to seek healthcare early. Globally, men often control decisions about the health of their wives and children, including the family's use of healthcare services. Therefore, the objectives of the study related to exploring the process of healthcare decision-making and autonomy practices amongst married men and women in northern Nigeria. A qualitative descriptive research design was employed whereby data was gathered from both married men and married women through semi-structured interviews and focus group discussions. Guided by Anderson's health belief model, findings from the study confirmed that poor health-seeking behaviors were apparent due to lack of autonomy for married women. Notably, strengthening collaboration and partnerships between healthcare workers and the community was a means to create a platform where critical information regarding healthcare-related issues could be discussed. This led to a tailored practice framework being developed to facilitate healthcare decision-making and autonomy practices amongst married women in northern Nigeria. Adoption of this framework may influence the death rate of women who give birth at home without antenatal care during the period of pregnancy. The framework can also act as a lever to guide legislation that will assist women with autonomous decision-making with antenatal care, delivery, and postnatal services. Such legislation may promote a new awareness of mother and child delivery and care services across Nigeria. Thank you.
For the degree of nursing, of Doctor of Nursing, I present Mary Paul. For the degree of Doctor of Philosophy in Emergency Medical Care, the title of the thesis, Assessment of Psychological Stress on the Clinical Performance Experienced by Paramedic Students During Clinical Simulations. The study was supervised by Professor C.C. Jinabai, co-supervised by Dr. Prakas Chandra and Dr. S. Sobua. I now call upon Professor Jinabai to read the summary.
This doctoral thesis presents a comprehensive insight into the degree of stress experienced by paramedic students during the clinical assessments in the Faculty of Health Sciences at DUT. Available evidence suggests that high anxiety levels may impact on clinical performance negatively. This can then lead to poor patient safety outcomes. The first unique feature of the study was that multiple validated psychological as well as physiological biometric tools were used by the candidate to generate the most accurate and complete stress profiles of the cohort of DUT students that he studied. Secondly, psychological stress was measured using the validated state trait anxiety inventory questionnaire, and concurrently, in addition to that, biological indicators were also utilized to capture the participants' physiological biomarkers, which included salivary samples, both alpha amylase and cortisol assay, heart rate, respiratory rate, as well as heart rate variability. Thirdly, the data was captured using a unique Hexoskin smart vest connected platform. This was the first time in Africa that this biometric online technology was utilized to capture respiration and cardiovascular stress biomarkers in this groundbreaking research study. The study findings highlighted that both the control and the experimental groups were exposed to clinical simulation-based learning environments which predisposed them to elevated anxiety levels before, during, and after these activities. These elevated stress biomarkers, which may impact learning and performance negatively. Ultimately, the students must develop the ability to integrate their cognitive ability, specialized practical knowledge, and ethical awareness, including stress management skills, into the clinical practice to become caring and professional healthcare providers and paramedics. This study further highlighted the breadth and depth of research expertise at DUT, the laboratory, technical, and scientific resources to undertake complex interdisciplinary clinical, behavioral, and epidemiological empirical studies directly impacting on the pedagogic outcomes and improve graduate attributes of DUT's student-centered approach to fulfill Envision 2030. Thank you.
For the degree of Doctor of Philosophy in Emergency Medical Care, I present Irfan Ismail. For the degree of Doctor of Philosophy in Health Sciences, the title of the thesis is a communication model on electronic integration of hospital patient health information and records management at tertiary hospitals. The study was supervised by Professor M.N. Sibiya and co-supervised by Professor O. Oladimeji. I will call upon Professor Sibiya to read the summary.
Access to patient medical history information is maintained by the provider over time, which may include all of the key administrative and clinical data. Due to manual record keeping, reports may become cumbersome to retrieve. The aim of the study was to develop a communication model for the electronic integration of hospital patient health information and records management, highlighting the flow of communication between members of the health team contributing to patient care in tertiary hospitals. A convergent, parallel, mixed methods approach was used to guide the study. A total of 61 health information management professionals participated in the survey. Interviews were conducted with 20 selected healthcare professionals across various disciplines who are managing patients with electronic health records. Analysis of the quantitative data was done using frequency tables, percentages, one-sample statistics tests, a t-test, and other statistical tests, while content analysis using the 4 stages was employed to analyze qualitative data. Results from both quantitative and qualitative data were used to develop a communication model for the electronic integration of hospital patient health information and records management. Results from both quantitative and qualitative data revealed that staff proficiency in computer software skills was rated highest for MS Word, while the lowest was for MS Access. There was also significant proof that environmental support exists for the implementation of electronic health records in hospitals. Barriers to successful implementation and integration were also highlighted, including staff shortages, large number of patients, and a lack of information and communication technology navigation skills. From this study, Toyin has published an article in an accredited international journal, and 3 manuscripts are under review. Thank you.
For the degree of Doctor of Philosophy in Health Sciences, I present Oluwatoyin Akinyemi. For the degree of Doctor of Philosophy in Health Sciences, the title of the thesis, Reconstructing Wellness Among Australian Families Transitioning Through the COVID-19 Pandemic. The study was supervised by Professor R. Bagwan. I will then hand over to Prof. Bagwan to read the summary.
Given the lack of empirical research related to family well-being, the study sought to explore how family wellness was affected in a multidimensional way within the COVID-19 pandemic, and tried to understand how family life may be reconstructed in light of the stresses relating to the wellness dimensions that have been brought to bear upon families in Melbourne, Australia. Hence, a qualitative approach was used through semi-structured interviews in which the researcher interrogated the lived experiences and perspectives of sampled families. The key findings showed that some of the families suffered job losses and business shutdowns, while many families experienced heightened psychological and mental health effects. Equally, the closure of religious centers contributed to feelings of hopelessness and loss of direction, while household domestic waste increased due to families working and schooling from home. Families experienced financial instability and physical activities were disrupted, which contributed to weight gain. In addition, the families experienced social isolation, while their intellectual wellness was compromised due to limited access to learning materials. Nevertheless, the families managed to create pathways to circumvent the constraints imposed by the lockdown. The critical finding of the study revealed that the support structure provided by families has a major effect on how the families reconstructed and maintained their wellness during the pandemic, and thus the family-centric support system was recommended in the study. The research highlighted diverse, holistic approaches as alternative methodologies in preserving and reconstructing family life regarding wellness across 8 dimensions. These were considered in a recommended wellness framework. Thank you.
For the degree of Doctor of Philosophy in Health Sciences, I present Jerusalem Dorosami. Congratulations. For the degree of Doctor of Philosophy in Health Sciences, the title of the thesis, Guidelines for Disclosure of Traditional Medicine Use to Allopathic Medicine Practitioners by Patients who use both traditional and allopathic medicine at selected hospitals in Gauteng in South Africa. Supervised by Dr. B.P. Nkosi and Professor Sibiya, I will call upon Prof. Sibiya to read the summary.
The aim of the study was to explore and describe the perceptions of allopathic medicine practitioners regarding disclosure of traditional medicine use to allopathic medicine practitioners by patients who use both traditional medicine and allopathic medicine, and ultimately to develop guidelines for disclosure of traditional medicine use to AMPs at selected hospitals in Gauteng. An exploratory, descriptive, qualitative research design was employed to guide the study. The opinions of AMPs who met the non-probability purposive sampling inclusion criteria were explored and described. Data were gathered using one-on-one, mass semi-structured interviews and qualitative observations of AMPs in their natural environment. Qualitative content analysis was used to analyze qualitative data. The analysis began with coding of the data, which was facilitated by computer-assisted qualitative data analysis software. The findings were triangulated and integrated with Petronius communication privacy management theory as a theoretical framework informing the study to help delineate correspondence concerning the phenomenon. The findings of the one-on-one semi-structured interviews revealed that the practice of AMPs in Gauteng regarding the concurrent use of traditional medicine and allopathic medicine by patients they consult with is limited by their knowledge of the traditional medicine used by these patients. Secondary elements of non-disclosure include stigma, AMP attitudes, AMP training, belief system, lack of knowledge, lack of communication skills, scoffing at TM, and prejudice. The research findings prompted the development of guidelines and recommendations for stakeholders involved in patient care and management in Gauteng. Thank you.
For the degree of Doctor of Philosophy in Health Sciences, I present Lindiwe Gumede. The title of the thesis is A Practice Framework to Improve Accessibility of Maternal Health Care Services for Women with Disabilities in KwaZulu-Natal, South Africa. The study was supervised by Professor M.N. Sibia and Dr. P.B. Nkosi. Prof. Sibia will read the summary.
The aim of the study was to explore the factors that impact access to public maternal health care services for women with disabilities in KwaZulu-Natal, with the ultimate goal of developing a practice framework to improve women with disabilities access to maternal health care services. An in-depth qualitative study was conducted using the case study method. Interviews and focus group discussions were used to collect data. 12 women with disabilities, 4 with physical impairments, 4 with hearing impairments, and 4 with visual impairments were interviewed for the study. Focus group discussions were conducted with 16 midwives, and one-on-one interviews were conducted with 4 gynecologists and 1 medical officer. Data were transcribed verbatim and analyzed utilizing the framework of assessing infrastructural and personal factors. These factors are interconnected to either positively or negatively impact access to maternal health care services for women with disabilities. Systemic factors include availability of human resources, training on handling pregnant women with disabilities, and availability of sign language interpreters. Infrastructural factors include the design and layout of buildings, adjustable equipment, and assistive devices. Personal factors include attitudes of healthcare workers to pregnant women with disabilities, empowerment amongst women with disabilities, availability of a companion, and the ability to read and write. The study provides a practice framework that could improve women with disabilities' access to maternal health care services by referring to the conceptual framework of accessing healthcare services. Thank you.
The degree of Doctor of Philosophy in Health Sciences, I present Doreen Mehta. Congratulations. The title of the thesis is Nephrotoxicity Associated with Preeclampsia in an Arginine Vasopressin-Induced Rat Pregnancy Model. Supervised by Professor N. Govender and Professor T. Naika. I will call Professor Govender to read the summary.
Renal injury is closely associated with the pathophysiology of preeclampsia and the risk of kidney disease. Given the clinical and ethical complexities associated with human pregnancy studies, animal models provide a more feasible alternative for pregnancy research. This study aimed to determine the physiological and biochemical characteristics of the arginine vasopressin-induced rat model of preeclampsia, as well as evaluate the nephrotoxicity associated with the model. Urine, blood, and kidney samples were collected from pregnant ABP, pregnant saline, non-pregnant ABP, and non-pregnant saline rats. Renal injury was histologically determined by hematoxylin and eosin staining, immunolocalization of the kidney injury molecule 1, KIM1, and podocalcin, as well as the ultrastructural changes in ABP-treated and untreated kidneys. Additionally, the urinary concentration of proteins associated with kidney injury was measured. ABP infusion throughout gestation increased blood pressure, urinary protein levels, and fetal growth restriction. Immunohistochemical analysis confirmed KIM1 immunolocalization in the renal proximal convoluted tubules, while podocalcin was mildly immunolocalized in the glomeruli of pregnant ABP-treated kidneys. Histological and ultrastructural evaluation confirmed abnormalities such as tubular and vascular necrosis, mitochondrial dysfunction, cytoplasmic lysis, and podocyte effacement with nuclear crenations consistent with renal injury in human preeclampsia. ABP significantly reduces the levels of urinary vascular endothelial growth factor A whilst upregulating clusterin, cystatin C, beta-2 microglobulin, KIM1, neutrophil gelatinase-associated lipocalcin-2, osteopontin, as well as tissue inhibitor of the metalloproteinases 1. This novel study demonstrates that ABP induces kidney injury and endothelial dysfunction in a rodent model, with characteristics observed in human preeclampsia. The findings support the use of this model in future studies investigating the development of preeclampsia. Thank you.
For the degree of Doctor of Philosophy in Health Sciences, I present Sabna Ramdin. Congratulations. The title of the thesis is Evaluation of Selected South African Medicinal Plants in the Treatment of Preeclampsia, supervised by Professor N. Govender and Professor T. Naika. Professor Govender to read the summary.
Preeclampsia complicates an estimated 2.2 to 8% of pregnancies worldwide and is a major contributor to maternal and fetal morbidity and mortality. In South Africa, the impact of preeclampsia is amplified due to strained public healthcare resources. Since conventional therapeutic strategies are costly and often associated with side effects, the scientific validation of alternative approaches such as phytotherapy has gained renewed interest. Traditional medicinal plants are a rich source of phytocompounds, displaying various biological activities and are easily accessible. Therefore, this study aimed to determine the potential applications of various South African medicinal plants and their phytocompounds in the management of preeclampsia by investigating their antioxidative and angiotensin converting inhibitory activities. Additionally, the antihypertensive properties of risperidone in a novel ABP rat model of preeclampsia was investigated. Of the medicinal plants and phytocompounds evaluated, Dombeya rotenfolia, risperidone, and nicotinamide demonstrated significant ACE inhibitory and antioxidant activity, showing the best potential for management of preeclampsia-related symptoms. Risperidone administration alleviated ABP-induced hypertension associated with preeclampsia development and improved maternal and fetal outcomes. Urinary protein, creatine levels, as well as biochemical and hematological markers, including white blood cell counts and lymphocyte levels, were significantly improved following the treatment with the phytocompound. Our findings suggest the potential of medicinal plants to improve oxidative stress-associated disorders. Furthermore, risperidone improves physiological outcomes in the rodent model and supports its potential in the treatment of preeclampsia. We provide significant physiological evidence for the use of risperidone as an alternative antihypertensive agent in resource-limited areas where conventional drugs are often costly and inaccessible. Thank you.
For the degree of Doctor of Philosophy in Health Sciences, I present Rebecca Reddy. Vice Chancellor, for the degree of Masters of Health Sciences, I present Rashni Bikram. The title of the dissertation is Experiences of Healthcare Workers as Patients During the COVID-19 Pandemic at a Private Health Facility in the Umgungundlovu District in KwaZulu-Natal, supervised by Dr. S. Guman and Dr. V. Naidu. The title of the dissertation is Spirituality as a Guiding Methodology in Working Through the Childhood Experiences of Grief and Loss. Supervised by Professor R. Bagwan, I present Nontobeko Peniel Biela. The title of the dissertation, Biopsychosocial Effects of a Prosthesis and Roles of Prosthetists in Improving Quality of Life of Transtibial Amputees, supervised by Prof. R. Bagwan and Prof. N. Govender. I present Riona Chetty, cum laude. The title of the dissertation, Poor Sanitation and Hygiene Practices, a case study of Ezimangweni in Inanda, eThekwini Municipality, supervised by Dr. S. Guman and Professor C.C. Jinebai. I present Zungezi Wiseman Tutu. For the degree of Masters of Health Sciences in Clinical Technology, the title of the dissertation, Determinants of QRS Duration in a Diverse Cardiomyopathy Population of the Western Cape, Implications for Eligibility for Cardiac Resynchronization Therapy, supervised by Dr. D.R. Prakachandra and Dr. H. Wage. I present Sanele Maxwell Dlamini. The title of the dissertation, an investigation into the association between Fabry disease, its clinical manifestations, and chronic renal failure in patients attending public hospitals in KwaZulu-Natal, supervised by Dr. S.C. Benjamin and co-supervised by Professor A.G.H. Asonga. I present Gillian Singh. For the degree of Master of Health Sciences in Emergency Medical Care. The title of the dissertation, The Use and Effectiveness of the Tools Designed to Reduce Emergency Medical Care Personnel Workplace Stress, a Critical Analysis, supervised by Dr. A. Seymour Walsh, co-supervised by Ms. P.S. Mchali. I present Malusi Richmond Mtetwa. Well done. For the degree of Master of Health Sciences in Environmental Health, the title of the dissertation, an investigation of upper respiratory symptoms and related exposure to diesel exhaust emissions among employees at selected paint manufacturing industries within eThekwini in KwaZulu-Natal, South Africa. Supervised by Dr. I. Niranjan, co-supervised by Ms. APLD Bigara. I present Michael Brandon Kinsey. The title of the dissertation, Food Hygiene in the National Schools Nutrition Program among Primary Schools in Vryheid in KwaZulu-Natal, South Africa, supervised by Professor P. Reddy and co-supervised by Dr. N. Mchunu and Ms. M. N. Dalasile. I present Sithembile Madlala. Well done. The title of the dissertation, Living with Diabetes, Managing Treatment and the Psychosocial Aspects of the Disease, supervised by Prof. R. Bagwan and co-supervised by Professor P. Reddy and Professor N. Govender. I present Udvana Ramraj. The dissertation is titled The Perception and Knowledge of Environmental Health Practitioners in Ensuring Health and Safety in Communities in the King Cetshwayo District in KwaZulu-Natal, supervised by Dr. S. Guman and co-supervised by Dr. V. Naidu. I present Mayenziwe Sanele Sibia. For the degree of Master of Health Sciences in Medical Laboratory Science. The title of the dissertation, Investigation of In Vitro Susceptibility of OXA48 carbapenemase producing antibacterials to ceftazidime avibactam over a 4-year period, a longitudinal retrospective study co-supervised by Dr. J. N. Bata and co-supervised by Dr. K. Moodley. I present Nomagugu Ndumo. The title for the degree of Master of Health Sciences in Environmental Health, the title of the dissertation, An Investigation into the Occupational Risk Factors and Prevalence of Communicable Diseases amongst Healthcare Risk Waste Handlers of a Treatment Plant at eThekwini District in KwaZulu-Natal, supervised by Dr. S. Guman and co-supervised by Ms. M. N. Dalasile. I present Siphephile Innocentia Mieni. For the degree of Master of Health Sciences in Nursing, the title of the dissertation, Preparedness of Bridging Program Graduate Nurses to Assume the Role of a Newly Qualified Professional Nurse, supervised by Dr. D.G. Sokela and co-supervised by Ms. S. Pillay and Ms. M. Kupasamy. I present Selvam Karapam. The title of the dissertation, An Evaluation of the Knowledge and Practices of Primary Healthcare Nurses in the Collection of Clinical Specimens at the King Cetshwayo District in KwaZulu-Natal, South Africa, co-supervised by Dr. A. Razak and co-supervised by Ms. P. Pillay. I present Bekisiwe Tobekile Mthethwa. The title of the dissertation, Lived Experiences of Post-Penectomy Patients. receiving health care from public hospitals in KwaZulu-Natal, a phenomenological study supervised by Dr. D.G. Sokela and Mr. N. Sibanda. I present Virginia Vuyokazi Ndlovu. Well done. For the study titled Alcohol Use Among Students in a University of Technology in KwaZulu-Natal, South Africa, supervised by Dr. D.G. Sokela and co-supervised by Ms. H.T. Mahlanze, I present Florence Buzani Ntombela. Well done. For the study titled Operationalization and Implementation Experiences of COVID-19 Response Guidelines by Nurse Managers at Selected Private Hospitals in KwaZulu-Natal, South Africa, supervised by Dr. V. Naidu, I present Shamita Raghunath. Well done. For the study titled Experiences of Non-Critical Care Trained Professional Nurses Deployed to Work in the ICU during the COVID-19 pandemic, supervised by Dr. V. Naidu and co-supervised by Dr. N.P. Zigalala, I present Rena Sivnarain. For the degree of Master of Health Sciences in Chiropractic, the title of the dissertation, An Investigation into Musculoskeletal Pain Associated with Primary Dysmenorrhea in Students at a University of Technology, a Descriptive Study, supervised by Dr. A. Abdul Rashid. I present Heidi Michaela Chapman. The study is titled The Epidemiology of Work-Related Neck Pain in Diagnostic Radiographers Working in the eThekwini Municipality, supervised by Dr. A. Abdul Rashid. I present Akshoy Devnarain. The title of the dissertation, The Perceptions and Experiences of Chiropractic Master Students on Practicing Evidence-Based Practice during their clinical practicum at a teaching clinic in KwaZulu-Natal, supervised by Dr. D. Varatharajulu. I present Tasmia Tayob. The title of the dissertation, An Exploration into the Life World of Patients with Cluster Headache in South Africa, supervised by Dr. D. Varatharajulu. I present Tanya Brenda Shipping. The title of the dissertation, The Immediate Effect of Chiropractic Cervical Spinal Manipulative Therapy on Joint Position Sense and Balance in Elderly Patients in the eThekwini Municipality, supervised by Dr. D. Varatharajulu and co-supervised by Dr. C.K. Prince, I present Robin Deborah Bonsma. Yes. Okay. For the degree of Master of Technology in Chiropractic. The title of the dissertation, The Knowledge, Attitudes, and Perceptions of Qualified Chiropractors and Physiotherapists in South Africa regarding the other professional practice, supervised by Dr. S.S. Maharaj and co-supervised by Dr. C.K. Prince. I present Michaela Ravidot. Well done. Vice Chancellor, I now call upon the relevant HODs to present the names of the graduates as per the program. Thank you.
Vice Chancellor for the degree of Bachelor of Child and Youth Care, I present Zinhle Sibane. Kulaliwe Dumakude. Tabile Gazu. Amashle Gumbi. Inamandla Gumede cum laude. Londiwe Gumede. Smangaliso Shlachwayo. Pumelelani Shlope, cum laude. Nurain Khan. Nkosikimpile Kumalo, cum laude. Nozishle Kumalo. Nomfundo Kusu. Sinenhlanhla Mbele. Ozuko Mendwana. Sishle Mkombo. Pumla Mguni. Ntombi Kaise Mutlaung. Bonasiwe Mpongose. Nkosikona Matabela. Nokwanda Mtetwa, cum laude, and has received the Dean's Merit Award for Academic Excellence. Well done. Tando Mtumkulu. Sipesishle Mzwobe. Spindile Ngidi. Spamandla Ngubane. Ngukolo Glema. Sunoliswi Nklongwana, cum laude. Slendile Nchangase. Londeka Ntuli. Lungelwa Nyaba. Sisipo Sigabi. Bayanda Sithole. Nomvelo Gimba. Zanele Zikali. Vice Chancellor for the degree of Bachelor of Health Sciences in Chiropractic, I present Carmen Bassioni. Jonathan Blackburn. Robin Blaine. Ryan Eads. Jan Frederick Enslen. Hilton Ford. Trishul Harilal. Amina Kolia. Jasmine Lloyd. Sarah Milner. Jamie Olfson. Cherie Steenkamp. Jason Vermaak. Vice Chancellor for the degree of Bachelor of Health Sciences in Clinical Technology, I present Tasneem Bana. Nikita Bachu. Safia Badat, cum laude. Sinetemba Buthelezi. Shikara Debi Narayan. Diajal Duchan. Akona Glembula. Aisha Essa, cum laude. Rakiba Essa. Shanice Esak. Notando Fakude. Vanuel Faseha. Lendani Gambushe. Trenusha Golf, cum laude. Priyanka Govender. Selina Govindasamy. Yastil Govindasamy. Azra Jadwat. Nazia Khan. Nontombeko Kumalo. Spelele Kumalo. Shabir Mohammed. Nyaniso Mbiza. Mobile Mamela. Fatima Said. Kalosa Mahoye. Naledi Mutlaong. Fikara Naidu. Yuresha Naik, cum laude and the Dean's Merit Award for Academic Excellence. Suman Narayan. Mbuso Ngongo. Eletu Nchishi. Lusanda Ntuli. Minentle Radebe. Thank you. Tobojo Siesta. Sipesishle Sabia. Alyssa Solomon. Jarvan Velayadam.
Vice Chancellor for the degree of Bachelor of Health Sciences in Emergency Medical Care, I present Karen Nicole Bauscher. Sebastian George Steele de Klerk. Kashvir Ishir Persad. Wasim Ahmed Khan. Mbongiseni Pioni Kunene. Ransom Siluleko Lu Koyama. Simpiwe David Majola. Sinakho konke Magumwane Lwazi Mthokozisi Marengane. Jabulani Ntokozo Mdaba. Tashendran Munsani Pillay. Emma Roberts. Jonathan David Russell. Alisa van der Berg. Vice Chancellor for the degree of Bachelor of Health Sciences in Environmental Health, I present Atlehang Basi. Tashiana Devanathan, she received the degree cum laude and the Dean's Merit Award for Academic Excellence. Spelele Dlamini. Ngobile Penelope Ganza. Sboniso Tebo Kanyile. Luciwe Kumalo. Nomfundo Samantha Valencia Kunene. Nomfundo Langa. Luyanda Stanton Mabuyakulu. Sanelisiwe Snentlantla Madala. Guguletu Pumelele Nzelelo Madonzela. Asanda Sanelisiwe Mbata. Nokanya Tandiwe Mbata. Sfezile Faith Ngobo. Anele Nkosi. Ntlantla Thabiso Nyawo. Snatemba Mhlonishwa Nyawose. Nompumelelo Fezile Nzuza. Prudence Pomolo Pasha. Rayona Simla Ramrup. Bonagaliso Eloquence Shandu. Pelogazi Abigail Tenza. Vice Chancellor for the degree of Bachelor of Health Sciences in Homeopathy, I present Bekani Mzwandile Dlamini. Snentlantla Xolile Dlamini. Fezile Hlophe. Noltando Azande Madala. Sianda Ngubeko Magwaza. Mantwa Malati. Wendy Nomonde Mbambo. Susan Mbonambi. Lizwe Mkize. Zamatemba Minentle Mtembu. Snenkosi Blessing Mchali. Nobile Nosisa Njapa. Spesihle Angel Ntombela. Nozipo Tasiselwe Potgieter. Thank you. Thank you. Peggy Mandisa Shabangu. Ayanda Stabile Shozi. Thank you. Ngobile Twala. Sanelisiwe Hope Vilagazi. Spatiso Gugulama Zulu, Zulu. Thank you. Sizwe Zulu.
Vice Chancellor, for the degree of Bachelor of Health Sciences in Medical Laboratory Science, I present Humera Banu. Rikil Bundu. Cum laude. Tinil Chadram. Chetty Kirasan. Damane Tunyiso. Zaida Isaac. Nolwazi Fisher. Gulam Muhammad. Gavenda Tashmika. Clarice Joseph, cum laude. Zamile Kumalo. Ayushi Lachman, cum laude, Dean's Merit Award for Academic Excellence. Kurisha Maestri. Loiso Mbeche. Silindile Mkhize. Refilwe Murake. Nonjabulo Mpungose. Kaylin Munsami, cum laude. Ndebele Snetsemba. Nene Ntutsuko. Ngamu Anele. Minenhle Ngubane. Nzuza Asanda. Lynette Pillay, cum laude. Nerita Ramata. Lwandiso Rubela. Nomcebo Shabangu. Kululego Shelembe. Duduzi Shezi. Tashmika Singh. Laika Sayed. Nkosinathi Zondi. Vice Chancellor. Thank you. Vice Chancellor for the degree of Bachelor of Health Sciences in Medical Orthotics and Prosthetics, Anne-May Bierkes. Frank St. Patrick Brandon. Chloe Preda. Keda Darampal. Siposethu Gama. Wandile Gumede. Menaz KG. Nokuphila Khuzwayo. Duthuko Mdlalose. Sindi Mncwabe. Mahle Mncwango. Thuso Mshweshwe. Natasha Msimang. Nondumiso Msomi. Andile Mthembu. Daniel Neya. Siphumelele Nxumalo. Nikhil Perumal. Parent Pool. Nikisha Singh, Sipiwe Zengele,
Vice-Chancellor, ladies and gentlemen, let's have a round of applause for all of our graduates. Congratulations. So, graduates, what a journey. What a journey. You all deserve to put your mortarboards on now. You've worked very hard. You graduates, so stick them on. Because in a short while, I'm going to ask you to throw them in the air, so it's important you have them on your head. What an incredible journey. We are so proud of you, graduates. We know the sacrifices that you have had to make along the way. The time, the money, the energy, the effort. You remember the early mornings? The late nights? You remember spending hours and hours and hours in the library? You remember Saturday nights when your friends would call you and say, hey, let's go party. What did you say? No, not me. I'm studying. Do you remember the face masks and social distancing? The online lectures, online tests, online exams. I know at times you may have thought, it's tough being a student. Now we even have a global pandemic to deal with. But you persevered. You had faith. You believed in yourself. And today is proof in front of this congregation, at this very moment, on this day, you have graduated. And despite all of this, you always had people in your corner. You always had people believing in you, encouraging you, loving you, and praying for you. Some of your people are here today, graduates. As we say in KwaZulu-Natal, umuntu, ngamuntu, ngabantu. A person is a person because of people. So graduates, I'm going to ask you to help me, to help you, to say thank you to your people who are here and who are watching online. So please stand, graduates, and turn to your right and face your loved ones and give them a round of applause to say thank you, ngiyabonga kakhulu, for the love and support over this academic journey. Thank you, graduates. And now face the stage. Many of your teaching staff, your lecturers are here. Many are still on campus. And let's say thank you to the Faculty of Health Sciences for the role they played on your academic journey, and the DUT family. Thank you. And finally, graduates, please remain standing. It's time to get ready for liftoff. Get your hands on your mortarboards. Vice-Chancellor, ladies and gentlemen, we proudly present the graduating class of 2022. Make some noise! Congratulations, graduates. Thank you. You may be seated. Thank you. Thank you so much. Thank you. So we did say we were hoping to get you on the road and celebrating by 11:30. We're running a few minutes behind. We just have a few more formalities from the podium. In a short while, we will sing the national anthem. We will then dissolve the congregation and the Vice-Chancellor will lead us off stage. Before we do that, for some closing remarks, please welcome back to the podium the Executive Dean for the Faculty of Health Sciences, Professor Mkunu. Prof.
Thank you, Mr. Khan. Firstly, I would like to acknowledge in absentia the Chancellor, Madam Nonkululeko Nyembezi, the Chair of the DUT Council, Mr. Wiseman Madinane, members of the Council who are here today. The Vice Chancellor and Principal, Professor Tandom Tembu, Professor Karim and his wife, Dr. Karisha Karim, who is here today, family and friends, members of the executive management, colleagues from all faculties, especially the Faculty of Health Sciences, stakeholders, graduates, parents, siblings, ladies and gentlemen, let me just say all protocol observed. Sanbonani? Now, nashe ngathi nidangele nje. Good morning, everyone. It is my pleasure to deliver this congratulatory message and vote of thanks this morning. I would like to take this opportunity to congratulate you, the class of 2022, for your phenomenal achievements against all odds. A special congratulations to Prof. Salim Abdul Karim, who is here with us. Thank you so much, Prof. To all our guests here this morning, we are greatly honored and privileged that you could make time to come and share this memorable day with us today. A huge thank you goes out to the staff in the Faculty of Health Sciences and other faculties who are represented here today, both academic and support staff. We thank you for your presence and for showcasing our faculty with the caliber of graduates that we have in the faculty and in our institution. Let's continue doing this the DUT way. Bazali nezihlobo ake ngithi ukubongela nina kakhulu. Siyabonga ngokusithemba nisiboleke abantwana benu. Bafika bebancane la ningaboni sebenje. Bafika bebancane saqala sababumba sibenza lokho abayikhona enikubonayo namhlanje nabo abebefisa ukuthi babe yikhona. Siyathemba ukuthi uma nibheka emuva ngosuku ababeqale ngalo la mhla beqala eminyakeni edlule niyawubona umehluko okuphakathi kwangalelo langa namanje. We thank you for entrusting us with your precious children. Your children, I know how precious they are to all parents. So we thank all parents, family members, sponsors, guardians, and all our stakeholders. We thank you for the role that you have played in supporting these graduates. We know it hasn't been easy. It hasn't been an easy journey. Bekungelula kunina, kanti futhi nakwabafundisayo siyazi ukuthi bekungelula. One thing we know ukuthi abazali bawe bevuka nani kwaze kwaba manje. So uma bebenithethisa benza konke bezama ukuthi beniphusha ingoba bayanithanda. It's because they wanted you to become better individuals in future. We know you have the abazali, they have your best interest at heart. So we thank you for that, our dear parents. Much appreciation goes to the mentors and research supervisors for their assistance in ensuring that you complete your qualification, hence graduating today. A special thank you to our clinical partners. We don't thank them enough. Without you, there is no work-integrated learning, actually. There is no community engagement. When we send our students to our clinical partners, they are still learning to walk, actually, and you assist us to hold their hand, groom them to what we see here today. We appreciate your involvement in their training. A special thank you to the university support departments in both Durban and Midlands campuses, and to the staff and management of Olive Convention Center for hosting us. We thank you for coordinating the graduation ceremonies in this beautiful venue we are in today. Putting together an event like this takes a lot of effort, so we really appreciate all your efforts. To our honorary doctorate recipient today, Prof. Abdul Karim, we thank you for accepting our nomination. Being associated with a scientific giant like yourself means a lot to us as the university. We thank you and look forward to your meaningful partnership with our university. I hope that our graduates today have learned a lot just from listening to you, and that I hope they aspire to be scientists of such a high caliber like yourself one day. To our graduates today, it really warms my heart to see all the red gowns here in front. If you don't get goosebumps, I don't know. I don't know, really. If you do, I know you aspire to be here one day. Today defines the coming of age for you, or to all of you graduates, and the ending of one era of life as a student, and moving on to a new stage in which you are a leader, a doer, and an achiever in the wider world. Today, you are joining many hundreds of thoughtfully prepared professionals who are ready to serve the society with integrity. I'm very confident that you will fulfill your duty in your field of study. As you graduate and take on new challenges, remember that every class you've taken, every laboratory work, every assignment written, every assessment you've taken has been preparing you to adapt to change and challenges, because at DUT we train you to be adaptive graduates. As I was preparing this speech, I actually remembered that this cohort is a very special one that went through a lot. COVID-19, the floods, the looting, load shedding, ben gowisha kahle kahle. Currently, we are experiencing a surge of infectious diseases. Diseases we only got to read about, diphtheria, mumps, everything, even cholera. Kuningi. Now we are experiencing them, not just reading about them. Maybe you should be asking yourselves why this is happening in your lifetime. In you, I see the future academics, the future professors, the future scientists, future innovators, because our DUT and Vision 2030 talks about producing adaptive graduates. So as you graduate today, we are sending you to the society confident enough that you are these graduates who will be dealing with all the social ills we are experiencing in our country. We thank you for choosing DUT as your university of choice, and we hope that the number of years that you have spent with us at DUT has changed your lives for the better. We have faith in you, and we hope that your mind has been liberated during this whole process, and that you have developed into a well-rounded person that can accept the challenges of the future. In closing, I want to say this is not the end for you, but it's the new beginning. It's a new chapter in life. New endeavors, new challenges, new life lessons that are yet to be learned. We wish you all the best in the wonderful career that you have chosen. Please go out to the world and be the change that we have been waiting for. Fly the DUT flag high up by being creative, distinctive, and impactful. Once again, congratulations, be safe, and enjoy the rest of the day. Thank you.
Thank you for those lovely words, Professor Mkunu. Ladies and gentlemen, we're almost at the end of the formalities. Just one or two announcements. To the graduates, in your programs, you will find a QR code. That's from the Center for Quality Promotion and Assurance at DUT, and that's just to help us with the graduate survey. You can do it when you are free. You don't have to do it now. It's a couple of minutes and it will assist the university. We will also be sending you an SMS. You can click on the link if you don't want to scan the QR code. And we appreciate your few minutes to help us with the graduate survey. I will shortly invite the congregation to stand for the anthem. Now, when we sing the national anthem, please feel free to remain standing at all times. However, if you're unable to, for health reasons or any other reason to stand, it's fine to be seated. Gentlemen, I'm going to ask you to remove your mortarboards, your hats or your caps. Ladies, protocol allows you to keep your headgear on, so that will be fine. But gentlemen, if you could join me shortly to remove your headgear. At the end of the anthem, please remain standing. At that point, the Vice-Chancellor, Professor Mthembu, will formally dissolve this morning's congregation, which will mark the official end of this graduation ceremony. The Vice-Chancellor will then lead the procession off stage down the center aisle and will exit the hall at the back, at which time you can then safely, orderly, and patiently exit the auditorium and to continue with your celebrations. Remember, party hard, but party responsibly. Share your photographs, #DUTGrad23. Congratulations once again from the entire DUT family. We are immensely proud of you. Remember, your family needs you, your community needs you, our country needs you, and our continent needs you. So go on and make us proud. We wish you nothing but success and good fortune in your days ahead. Vice-Chancellor, ladies and gentlemen, if I could now invite the congregation to stand as we sing the national anthem of the Republic of South Africa. May God bless you and God bless South Africa.
May I just thank everybody for allowing us to run this beautiful ceremony in a dignified manner. Ngithanda ukubonga ngqongqoze ngokuthi nisivumele sihambise lo msebenzi njengokwenqubo, njengokwemigomo, njengokwemtheshwana yethu njengenyuvesi. Siyabonga kakhulu. To you graduates, you are very special for having had Professor Salim Abdul Karim graduating together with this cohort of graduates. He is an epitome of passion, perseverance, and excellence. And I would like you to take a leaf out of his life. And I hope to see more and more of you coming to graduate in the next few years. Ngithi-ke asinibonge-ke nani ebenethweswa iziqu. Uprofessor Abdul Karim njengoba naye ekhulumile ngokuthi kufanele nibe nentshisekelo eyintweni enizenzayo, kufanele nibe nokubekezela, kufanele nintininize phambili eyintweni enizenzayo. Siyethemba ukuthi nani eminyakeni engeminingi sizonibona senithathe iphethini kuyena. By virtue of the authority vested in me, I now dissolve this congregation of the Durban University of Technology. Ngegunya engilethwesiwe sengiyawuhlakaza-ke lo mbuthano wale nyuvesi yaseThekwini yezobuchwepheshe.